Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for children ophthalmia. What is ophthalmia? Ophthalmia or ophthalmitis is inflammation of the eyeball, especially its superficial surface, that is conjunctiva. The types of ophthalmia, there are so many types. Number 1, sympathetic ophthalmia, bilateral, following injury to one eye. Picture 1, bilateral. Number 2, gonococcal ophthalmia, does Neisseria gonorrhea is the reason. Picture 2. Generally it is neonatal from infection from the mother. Number 3, trachoma or Egyptian trachoma, chlamydia trachomis. Picture 3. Here the eye leads, the internal leads are severely affected. Number 4, photophthalmia. Number 5, photophthalmia. 6, other microbes, that is streptococcus, staphylococcus, haemophilus, pseudomonas, etc. And 7, other agents, diseases like UV rays, dust, smoke, cold, measles, pox. There are so many reasons from this ophthalmia can occur. Here in the last point, there are various diseases like cold, measles, pox. They can also create, or rather form this ophthalmia comes as a symptom of that particular disease. What are the signs symptoms of ophthalmia? Redness and swelling of palpebral or ocular conjunctiva. Profuse flow of acrid tears. Photophobia. Say picture 1. In case of photophobia, the patient cannot tolerate external light. Puffiness of eyes. Picture 2. Pain, burning, sand in the eye sensation. Malaise. In virulent or neglect cases, chemosis. Chemosis is in picture 2. Chemosis, some sort of puffiness also there. Keratitis, that is inflammation of the cornea. This is picture 3. There are 4 pictures in the number 3. All are of keratitis. And finally, blindness. In severe case, it may occur also. Special management in case of ophthalmia neonatal. Generally, ophthalmia neonatal is caused by either Neisseria gonorrhoeae or C, that is trachomatis, C. trachomatis. Whereas the first organism is virulently infective, deep penetrating in action. The second one is 2, sexually transmitted but less harmful, that is C. trachomatis. Here the subjects are neonatal who are extremely vulnerable, so special care must be taken to control spreading of infection as well as stop continuance of the same. Before attending the baby's nurse and mother must get their hands clean. Immediately after birth, the baby's eye must be wiped off thoroughly of the mucopurulent discharge with cold, sterilized water and fine linen. Appropriate remedy should be administered orally as soon as possible along with local hygienic measures. Care should be taken to stop spread of infection by dust and flies. Procedures of cleaning eyes must be repeated every morning till infection subsides. If mother still used to shed the causative organism via breast milk, breast feeding should better be held up. That is, when the mother is severely infected, all bodily discharges comes out of her contains the causative organism. This is shedding of shedding means that is that mother is spilling from his through his rather discharge of body, the causative organism is coming out. Supporting management in case of children ophthalmia. Children suffering from ophthalmia should be guarded against strong daylight or artificial light. That is, some covering up on the eye should be arranged. Their eyes must be cleaned with cold boiled water regularly in the morning, already said. They should be kept in a comfortable place far from dust, flies, mosquitoes and other insects. Their diet must comprise of fresh veggies and fruits, rich with vitamin A and vitamin C. A few vitamin A rich foods and C rich foods have been given in the photograph, images. Now, homeopathic therapeutics, that is remedies. Number one, acconated nap for children ophthalmia. Sudden devastating attack after exposure to cold wind, bath in cold water or injuries, strong light, etc. First remedy for rheumatic and arthritis ophthalmia. Eyes hard red, lids swollen, dry hot, sometimes with profuse lacrimations. Eyes feel like sandy with burning sensation and photophobia. Number two, Thuja for occidentalis. Thuja occidentalis for children ophthalmia. Very much suitable for ophthalmia neonatorum with gonococcal or chlamydia infection. Copious lacrimation in open air. Eye agglutinate with thick yellowish pus at night. Burning pain, better from warm, covering eyes warmly. Worse in cold wind and light. Number three, belladonna for children ophthalmia. Acute attack sudden with high level of inflammation, redness and photophobia, flushed face, intense temporal headache, but little lacrimation. Mostly adapted to flabby children with rosy red cheeks. Mercurius Sol for children ophthalmia. Almost specific for ophthalmia neonatorum due to congenital syphilis. Pain worse at night, in morning, agglutinated lids difficult to open owing to spasm, lids hard red, swollen, burn with profuse lacrimation, eyes itch, sore, intensely photophobic. Also a remedy par excellence for scrofulous ophthalmia. Number 5, euphrasia for children ophthalmia. Very much suitable for catarrhal and traumatic ophthalmia with bland coryza but acrid and copious lacrimation, making cheek look like varnished with intense photophobia to artificial light. Small blisters on cornea. Children blink often to relieve blurring of vision. 6, Rhus toxicodendron for children ophthalmia, especially for scrofulous inflammation with chemosis. Profuse flow of yellow pus at night leading to agglutination of lids and spasmodic closure of lids. Pains felt on moving eyeballs. Soreness in eye, cannot tolerate little pressure during day. Copious hot scalding tears on opening the lids. Intense photophobia. Here chemosis actually under 6 is written chemosis. Chemosis means inflammation with profuse accumulation of water in the eyeball. Eyeball looks like flooded with water. Chemosis. So everything is swollen. The lids are swollen. The whole eye is swollen and flooded with water. Now, arsenicum album for children ophthalmia. Intense burning, heat and excoriating lacrimation with photophobia. Worse at midnight from cold, better from warm application. Best for scrofulous ophthalmia. Subjects in anxiety, intensely fearful. Excellent in obstinate cases of scrofulous ophthalmia where other remedies fail. Number 8, Hiversal for children ophthalmia. A remedy par excellence for acute attack. Purulent ophthalmia with chemosis. Artificial light intolerable. Little pustules over cornea. Acute burning pain with feeling as if eyes were pulled back into the head. Pain better from application of warmth. Worse from touch or cold air. Then sulfur for children ophthalmia, especially for scrofulous or gonorrheal or foreign body inflicted ophthalmia with burning, itching, smarting, hot, acrid tears, worse in morning after opening eyes in open air, attack after suppression of a skin disease. Children dislike washing, dress on in bed, like sweets and fat. Number 10, Pasatella for children ophthalmia. For scrofulous or gonorrheal or catarrhal or post-measles ophthalmia with thick yellow discharge where children are soft, gentle, yielding but lachrymose. Intense itching, lacrimation, worse in the morning, better in open air. Now with this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I will certainly respond.